Topic of my presentation is orientation options of free fibula flap for head and neck reconstructions. So once you have raised the free fibula flap, it can be shaped into various forms to create symphysis, body and ramal region of the mandible in various shapes. So this is the example we are showing use of left leg for reconstruction of left-sided defect. Usually when there is a left-sided defect, we go for right side leg when we want to put more of skin inside mouth. When the skin is needed more of outside, then the left side leg can be used. So this is how osteotomy is done, and then the flap is placed like this. Now in this scenario, using the same left leg for right side facial defect, the osteotomy is done in inverted V form, and this is how the flap is inset in place. Now coming to the right leg for left sided facial defect, you have to make an inverted V shape osteotomy. And this is how the flap can be placed inside. So when you are using right leg, the skin pedal easily goes inside mouth. So that's why using right leg for left sided facial reconstruction and vice versa is advisable. In this case, we are using right leg for right sided defect. Again, you have to make a V-shaped osteotomy, and this is how the flap can be used. In some situations, when you don't get perforators in this portion, you get perforators a bit higher up, this kind of osteotomy can be done with skin paddle on the proximal aspect. And this is how the flap can be used for right-sided defect. Thank you.